To matters of the Africa CDC, because the Africa Center for Disease Control and Prevention has shown its dissatisfaction and disappointment with the European Union regarding access to COVID-19 vaccines. During its weekly press briefing on Thursday, the Africa CDC called on the EU to stay away from the policies that will complicate the fight against coronavirus. The CISA tells us more of that in this report.
Given the worrisome trajectory of COVID-19 vaccine distribution across the world, the Africa Center for Disease Control and Prevention is disappointed with the European Union for marginalization of the African continent. So far, about less than 1% of the African population has been vaccinated, thanks to unequitable distribution of vaccines globally. In what appears to be adding some salt into the injury, the European Union chose not to recognize vaccines administered in Africa, including the AstraZeneca, for travel pass within the EU. This move, according to the Africa CDC, might make vaccine provision for Africa even more harder, because the continent depends on these supplies under the WHO COVID-19 provision. In this slide, the Director of Africa CDC, John Kensong, called on the European to do away with principles that will make it further difficult to fight COVID-19.
A vaccine that has been supported by the Europeans and supported by COVAX, supported by WHO, will not be allowed to be on the list of vaccines that were recognized through the Green Pass process in Europe. We've always said when this pandemic started, that we should always use science, data to drive decisions. And I don't think this is one that was based on science and data, because if you look at the neutralizing antibody levels, which all these vaccines are generating against the spike protein, that the vaccine, that is the AZ vaccine produced in India, produces very high neutralizing antibodies. I think that is what, if they were producing less quality neutralizing antibodies, you probably argue that based on that, they are not fit to be recognized. So we are really calling on the European to stay away from such policies that will further undermine and make it difficult for us to fight this pandemic.
The zooming tough policies from the EU regarding global fight against COVID-19 appear to be a reminder of lessons learned that Africa cannot depend on countries for vaccine. John faced the pressure to assure that Africa can eliminate the pandemic by the end of next year, pending the availability of enough vaccines.
The fact of the matter is the EU has vaccine factories. It has vaccine production centers across Europe. Not a single dose, not one vial has left a European factory for Africa. Okay, when we've gone to talk to their manufacturers, they tell us that they are completely maxed out, meeting the needs of Europe. We are referred to India, okay, where a number of manufacturers exist that are manufacturing vaccines like the AstraZeneca vaccine under license. Okay, so Europe has to decide. You can't say you support us. They have vaccinated so many of their own people that they can now watch football without masks. Okay, our people have not been vaccinated. Less than 1% of our population has been vaccinated.
Strive Masiwa, the coordinator of African Vaccine Acquisition Team, expressed Africa's disappointment with the European Union for the fact that not a single dose has left European factories for Africa.
First of all, let's remain optimistic that the efforts that people like Strive, Professor Benedict Orama, Dr. Vera Songwe, and others are doing, working every night and from 9 p.m. to 11 p.m. To acquire these vaccines would yield fruits. That way, in the next 12 months or so, we vaccinate at speed and at scale. If we do that, and the population cooperate, and I did share some information with you today on how much countries are using their vaccines, which is a very good indicator of that. If we have a predictable supply of vaccines, the vaccines will be used. then we can defeat this pandemic. We can break the backbone of this pandemic by the end of next year.
As of July 2021, 5.5 million COVID-19 cases have been reported across the continent. This figure accounts for 3% of the total cases reported globally. Over 142,000 Africans have died from the virus, while 4.8 million people have recovered since the start of the pandemic. Reporting for iAfrica News, I am Daisy.